Welcome back, and thanks for joining us for another episode of Noble Thoughts. Today, we are talking about health with the Indiana Minority Health Coalition. We have Tony Gillespie with us. He's the Vice President of Public Policy. And tell me a little bit more about the role that you have and how you got here.
The role that I play is I'm the government relations person for Indiana Minority Health Coalition. I work primarily with our elected officials, from a state perspective, but also through our 20 coalitions around the state. We work at the community level, the municipal level. We regularly visit Capitol Hill to talk to our federal legislators because when you address these public health issues, it's at multiple layers in terms of the leadership piece and how you influence or affect policy. And health is very much a policy issue. It's a matter of making sure that policies that exist, everyone has access to services, everyone, whether it's a racial and ethnic perspective or rural versus metropolitan. It's important to know that as we address these public health issues, we're speaking directly to those most affected. And we do that through a lot of policy working with our legislators.
Could you break down some of those issues that you're seeing now?
Sure. We have, over the years, we've addressed every public health issue that has a disproportionate impact on racial and ethnic minority communities. And of some of the major ones, COVID, well, of course, was huge. That was a huge international issue. But for racial and ethnic communities, it was a big issue as well in terms of the fact that somehow as a country, we didn't know that health disparities were a major issue. And there were segments of the population that didn't have insurance coverage or didn't have access to quality care. So that's the kind of town crier position that we take, and calling those issues, talking about what's disparate, talking about who has access, talking about insurance to ensure that the services that are available speak to what everybody needs.
I know you do a lot of work in terms of maternal health. What are some of the disparities there?
Well, Indiana has the dubious distinction of being the state with the third highest maternal death rate. Not sure how we got there, and we've been working with partners, our state partners, our coalitions around the state, even national partners, and very much with legislators to try to unpack this to figure out how we got there and then what are the changes that need to be made to improve our rates. One of the things that we focused on, Indiana Minority Health Coalition, is doula care. Doulas are not medical personnel. They're trained support providers. They provide support to expectant families, helping mom access the best health care, visit the hospital to make sure the hospital has what she needs to ensure that it's a healthy birth outcome for both mom and baby. Part of what our edict is that we want mom to leave the hospital with a healthy baby, and we want a healthy baby to leave the hospital with a mom. We don't want to send a baby home with just a dad, or vice versa, or for mom and to not leave with a healthy baby. So our doula program, we work with pregnant women at the beginning of their pregnancy all the way until baby's first birthday, because we want to ensure that mom is healthy and baby is healthy families. That's what we're working on. And around the state, there are a lot of access disparities. Some parts of the state, they don't have a birthing hospital. The birthing unit in the hospital closed, and so women have to find some alternative. There are maternal health deserts in Indiana where there is no care. There is an OBGYN maybe for another 50 or 60 miles. And so part of what we're doing is working in those communities where access is the issue. Right now, our doula program, Community Doula Services, we specifically serve South Bend, Elkhart, and Logansport, and then smaller counties in between there. With our doulas, we have 8 doulas that are trained women. We have a racial and ethnic diverse group of doulas. They love the work that they do, and we just continue to get great feedback. One of our big policy issues was that in 2017, I think, the late Senator Gene Breaux worked to pass legislation for Medicaid reimbursement for doula services. We were one of the first states to pass that legislation. Unfortunately, it didn't get a budget assigned to it, so now we're kind of stuck between how do we get this funded? How do we ensure that this it's fully integrated into the maternal health delivery system in Indiana. So that's what we're really working on. We would love to see doula programs in multiple communities around the state. We continue to be asked, but funding is a huge issue. And in Indiana, which is the policy end of the thing, there were some financial issues with FSSA, which runs our Medicaid program, and so unfortunately, we've not made any significant movement from a policy standpoint. So we're really hoping that we can take what came out of this session and sort of analyze it and figure out how we are in a much better position to pass some of these bills that will improve maternal health in Indiana. And I think the great thing is that we have a governor who has articulated that that's a priority, to improve maternal health care in Indiana and improve infant care in Indiana. So we're ready for it. We're here for it. We want to keep addressing this issue. And then in addition to the maternal health issue, COVID was huge. We did a huge webinar. Since webinars became our mode of our platform to communicate, especially when we were shut in. But a lot of that hasn't changed. People still are not coming out. And so that webinar, being able to host that with partners that then they get their service-based people that they serve, and we have a much better chance of reaching a much larger audience with this critical information.
We're going to be working on a webinar coming up,
Yes,
discussing measles.
Right.
Why is this an issue as well?
Measles, I don't think anybody saw a measles outbreak coming, because in Indiana, across the country, we figured that was eradicated. Vaccine rates, we had reached herd immunity from a vaccine perspective, but now that's changed. There's misinformation out there. Indiana is one of a handful of states that's in the throes of a measles outbreak, and the numbers aren't huge right now, but they can, if nothing is done about it, if things like this don't occur, where people get correct information and not misinformation, and access to services. We've pulled together a great panel of our Marion County Health Department medical director, Dr. Virginia Kane, who's a national figure around communicable disease and health. Vaccinate Indiana, which is a state partner that goes around the state providing vaccines, and those things are very much needed. Even people with commercial insurance don't always have access to these kind of services. Depending on where you are, the size of your public health department, and it's just anything that you know. And vaccines are one of the things that they're available, they're accessible, it's no cost. It's just important that you avail yourself of those services. And again, with measles, it's a no-brainer that we have to do this because it affects children primarily. A case in Texas, they didn't know that the mom giving birth had measles, and so the whole nursery was exposed to a baby born with measles. So those are kind of things that we can and we must avoid. That doesn't have to happen. That's not one of the things that we don't have some control over. So that's what we want to do.
And here in Indiana, there was a hot spot, if you will, with multiple cases?
Allen County. The Fort Wayne area has multiple outbreaks, and so we've invited them to be part of our webinar to talk about, as a community, how they responded, as a local health department, how they're working to make sure those cases don't increase. For a nerd like me, it's very exciting work and it's very important work. And at the end of the day, the work that we do, we all have families and communities that we go back to. And I'm originally from Gary, Indiana, and there's a lot of need for this kind of information. And so through our network of coalitions, our affiliates around the state, we're able to touch multiple communities with these kind of efforts, and then great partners like you, we're able to get the word out. So I'm just so excited.
Happy to partner up with you guys. Respiratory illness is something else that you're passionate about, correct?
Again, it was just one of those things. We did a webinar last month where we talked about COVID, RSV, all the respiratory ailments and how we can avoid those, what the treatment protocol is, and how do you, these are all things that have a vaccine, to help eradicate. COVID is still very much an issue, and from a public health perspective, and the epidemic part of it is, has reduced, but it's still there. It's something we're always going to live with, and it's something that's avoidable. It's something that's avoidable. So these aren't diseases or conditions that inevitably people will get. These are conditions that we have some solutions for. So let's get that information out there. Let's make sure that, babies don't get RSV and seniors don't suffer from the flu when there are measures in place to avoid that. That's always been our effort, to avoid disease that doesn't have to happen, things that have either some prevention protocol in place or accessible, affordable treatment in place. And how do we get that to people? And we don't, as a society, we don't take information in the same. So the speaker never hears what the speaker speaks, or the listener never hears what the speaker speaks. I'm a big proponent of that. We have to say the same thing multiple times, multiple ways, multiple platforms to get to the people who need it, and that's our job. That's our job.
Well, let's circle back around. Vaccines. How do you really feel about them?
I'm a proponent of prevention. These are things that we do not have to suffer from. And unfortunately, healthcare is very political in this country. The maternal health rate, we are the industrialized nation with the highest maternal death rate in the world. And we're supposed to have the best health care in the world. We have the most expensive health care in the world. And so the fact that in Indiana, we have expectant families that suffer the unbelievable thing of losing a mom. And maternal death, it doesn't mean it attacks poor people or Medicaid populations. That's anyone. Many moms or many women who have died are not Medicaid. They're gainfully employed. They have a family. It's just poor health care, and that is something we can change.
And I know you're fighting really hard with legislation. Could you talk to us about some of the things that you're working on, or maybe that you'd even like to see?
Yeah. This last session, we had a number of bills that addressed some form of the maternal mortality issue. We looked for increasing the number of lactation pods around the state. There is a company that creates lactation pods to create safe and well-equipped lactation spaces to encourage moms to lactate, to breastfeed. And one of the pieces of legislation that we supported would have increased funding to have lactation pods in parts of the state where that's a big issue. Infant mortality is an issue, or maternal mortality is an issue, to improve it. Didn't get a hearing. Medicaid reimbursement for doulas didn't get a hearing. So we just believe that we need to work with our legislature to do some more education on why this is important, to understand why the bills didn't move, because we know that legislators come from communities around the state and they want to see those communities thrive. So what do we have to do to fix it? How do we change the language? How do we change the target? How do we, I'm a firm believer that you have to have the right messenger with the right message. And I run my mouth a lot, but I'm not always the best messenger. So how do we find the best messenger? And that has to involve community. I said this once at a meeting I was at, and I didn't get invited back. Mm-hmm. You can't provide public health and not involve the public. We have to talk to people to understand, how do we improve this service? Or is it the time? Is it the location? Some people don't want free. Some people need another adjective to describe that. And so whatever it is, we need to figure it out, and we have to do it. And again, fortunately, we have great relationships with our State Department of Health, and through our coalitions, great relationships with local or county health departments. So we just got to come together and figure this out. And I'm old, so we really need to get this work done, and we need to develop partnerships to bring new talent and new information and new concerns. So we're going to be here for a minute, and this work does not stop. If we don't do it, somebody has to do it.
How do neighbors here locally get involved? How do they build up community?
So we have 20 affiliates around the state, 20 minority health coalitions that we fund to do the same thing that we do, community education. There's a policy element to what they do. They work with their legislators. just building coalition, and that doesn't have to be anything formal. Like in IMHC, we've been here for 20 plus years. It could be something really informal, just a group in Northwest Indiana. They created a Moms Moving coalition. Is not a formal coalition in the sense, it's just moms and providers from around the area that are really concerned, and they've started to have conversation and communicating with their county officials around health and making services available, and they added OBGYNs to this coalition. So coalition is simply bringing like-minded and like-hearted people, people who feel and believe the same way, and start to do something. When we come together as people, we can make a movement. And so that's what we're trying to do, create these movements around the state. And it doesn't have to look the same. You don't have to call it the same thing, but you do have to have a presence, and we do have to engage people who are elected or appointed to serve us and hold them accountable. And accountability is not a bad word. And I think people become intimidated by the word accountability, or it's simply if we both have the same concern, how do we come together and make something happen? And that's what we're all about. So one of our local coalitions, give us a call. Visit www.imhc.org. All of our telephone numbers are listed. T. Gillespie at imhc.org. Hit me up. It's just important that we figure out how to get to where we want to get to.
Tony Gillespie, thank you so much for joining us and for being open and for sharing your noble thoughts.
Thank you. I don't know how noble they are, but okay, thank you.
And now I want to introduce you to the president and CEO of the Indiana Minority Health Coalition. This here is Carl Ellison. You began this work with just a small group of Hoosiers dedicated to growing healthy communities. Talk to us about those first few days.
Well, Brittany, Minority Health in Indiana really is sort of a work of grassroots citizens who decided to have a voice and make some difference in helping the state and really the nation improve health outcomes for minority citizens. So IMHC really itself, the Indiana Minority Health Coalition, is the child of local minority health coalitions that